Basically, under the new COVID-19 regulations and stuff like that, I think it is much more convenient for people to be able to get their medication and rather consult with the doctor over the phone. And if need be, that due to the severity of the patient, then the doctor could obviously advise them that they should actually go in so that they could assess what the situation may be.
For me, it's pointless, and I wouldn't prefer that because in most cases, it's going to be clear that if I can call a doctor, then they prescribe for me via phone, then it's something that I can just do, going to clicks and then explaining how am I sick, and then they can give me the medication that I want. So it's pointless for me. And also when it comes to expenses, I mean, I can't pay the doctor for calling the doctor and explaining why am I sick and I've got a headache, I've got this, I've got that, and then they send medication. It's pointless. I can just walk to clicks and then give them my symptoms and they give me what I want. So rather, I prefer going to the doctor, full examination, and I'm fine.
It's a 50-50 chance for me. The first 50, I would say yes, because it eliminates you going out and actually contracting something. And the other 50% says no, because now sometimes I can't explain what's wrong with me. I can physically show the doctor where it hurts. So now it's going to be a problem, me doing it over the phone. Do you understand? So it's going to be a problem. And then in terms of prescriptions, how am I going to take my prescriptions and get medication? Let's say maybe he prescribes something. I can't really write it down on my own and then take it there. It needs a doctor's note. Then I go to the prescription center and then they give me the medication.
What is telemedicine and how does it work? Do you prefer seeing your healthcare provider physically, or would you opt for telemedicine? What is the role of technology in medicine today, and how does technology improve patient care? What are the advantages? What are the disadvantages of technology in medicine? Is telemedicine expensive? Hello and welcome. I'm your host, Dr. Musam Tombele, and signing with us today is Trifosa Ntwele. On Vital Signs, we focus on medical technology in healthcare. And coming up on the program, we'll listen to an insert produced by Wandile Mufokeng. He spoke to a medical doctor and Chief Medical Officer at Curo Medical about medical technology in healthcare. We'll then speak to the CEO and co-founder of Curo Medical about medical technology in healthcare. I'll take you through some of the latest South African COVID-19 numbers, and Dr. Marlon McKay will answer any questions that you may have that have got to do with COVID. Remember that you can be part of the show by asking our guests some of the questions that you have in your mind by simply sharing your views with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Of course, we also use social media, so you can share your thoughts with us there at Twitter, or rather on Twitter, it's at SABC Vital Signs, and Facebook is SABC Vital Signs. We continue our discussion right after this ad break. Normally, doctors and other healthcare providers provide care for their patients at facilities such as clinics, medical offices, as well as hospitals. But thanks to computers, smartphones, and even other newer digital technology, medical professionals can now diagnose, treat, and oversee their patient care virtually. Let's learn how all of this is possible by taking a look.
Curo Medical Center provides essential elements of inpatient care in the comfort and convenience of the patient's home. We visited the center to find out how it works and what medical technology they offer.
So we are a South African digital health company, and we're pioneering in the hospital at home space. So what that means is that we are able to deliver care for patients in the comfort of their home, who ordinarily would have been admitted to hospital.
The big question to ask is, how do patients get this kind of service?
The patient who normally would be admitted to hospital would then start and see their GP, or would be seen in the casualty, for example. The patient would obviously be unwell at that point. The doctor who sees them at that point would then assess them and then write a referral through to us. It's a very seamless process, so completes a referral, we get it on our side. We then engage both the doctor as well as the patient themselves and ensure that the patient's then onboarded into our care. Once the patient's onboarded into our care, we then go out to the patient on a daily basis to see how they're doing, and obviously in conjunction with the 24/7 monitoring that we're able to do in the patient's home.
The services offered at the center is a comprehensive remote patient monitoring solutions. It offers 24-hour remote vital signs monitoring.
So effectively any patient admitted into our care receives the device. We then monitor the patient 24/7. We've got a clinical command center that is manned by healthcare professionals who know specifically, what to look for. So should there be any deviations in terms of anything of concern, we are then able to go out to the patient. If it's something of significant concern, we are then able to leverage our EMS partners who then go out to the patient's home and then can expedite the patient's admission into a normal brick and mortar facility, especially into a high care and ICU. But basically what it's able to monitor all the vital signs that you're able to see there. And to ensure that everything is as it should be. The product itself, the patch that we use, has triple regulatory authority. So that means that it's been approved by, it's FDA approved, it's CE marked, and it's also approved by SAPRA.
The advantage of this device is that your doctor gets to monitor you even after being discharged.
Very often doctors are actually blind to how their patients are doing at home. So you might see a patient in your practice, send the patient home, and then within a day or so the patient ends up deteriorating. What our technology then allows you to do, even as a doctor, is to ensure that when you see your patients admitted into our care, you continue to provide the clinical oversight, and you ensure that the patient, despite not being in your practice or in a hospital, is still completely looked after as if they were admitted in a hospital.
Nongcebon Sibande, a registered nurse, gave us a bit of a demo on how this new tech device works.
This is the patch. This is the one that picks up the heart rate, the respiratory rate, the ECG, and the skin, the core temperature. And then this is our oxygen saturation, and that picks up the oxygen levels in the body. They keep it on for however long the admission cycle is with us. So we come in and put it on, so depending on the option that the doctor has prescribed for the patient, the doctor can choose for us to just purely do remote patient monitoring, where we set up the patient and then we just monitor from our command center in our head office in Johannesburg. Then we're able to pick up these parameters. The other alternative is hospital at home, where we do go and do daily visits with the patient, depending on what the doctor has prescribed, either to give medication or do a follow-up check. When we get to the patient's house, we do a full clinical assessment of the patient, and then we're also able to just, based on this, also it gives us an ability to say if the patient needs further treatment or not.
We're trying to reimagine the way that healthcare is delivered in South Africa, and definitely also move into new and emerging markets, particularly within Africa as well as within Asia. So these sort of models have been sort of trialed in other parts of the world before, and we want to be the leaders in this space. So within South Africa, within new emerging markets, we want to be the leader within the digital health space in general.
After the break, we'll speak to Dr. Vuyani Mhlome, the CEO and co-founder of Kuro Medical, about medical technology in healthcare. Stay with us.
I prefer telemedicine only because, one, there's a convenience to it, so I wouldn't have to physically go and see my doctor. So I can relay what I'm feeling, which you usually do in a doctor's office. Then they assess that situation there. So contactless conversations is the times that you're moving to, so I prefer telemedicine.
For the longest time, we've always believed that being hospitalized it means that you're getting, essential treatment. It means that, you are getting seen by people. But I think when you really look at the pros versus the cons, of telemedicine and the way that they've been able to integrate how the service is delivered, I definitely would opt for getting care in the comfort of my own home.
I would definitely opt for telemedicine because it also provides me with the ability to have a doctor physically with me, knowing that I'm also monitored virtually and in the comfort of my home. And that's it's simple as that.
I can do both. It just depends where I am at the moment and what do I need to do. If I'm at my house and all of a sudden I'm not feeling well, I'll prefer to take a call and actually find out from a doctor, hey, this is happening, because I might not have the time to actually get to the doctor. So having the option of telemedicine for me is great because I can access the doctor wherever I am and at whatever time I feel like I can, unlike when I have to go see physically, even though in telemedicine sometimes you need to book an appointment, but I think it's much quicker to get a hold of the doctor and you'll be able to be assisted immediately and you don't need to be where they are. Even physical, I think if I have the time, I'll do it, but sometimes the time is just not there and you also want to just get checked and you want someone to give an opinion of what you might be suffering from and you won't just want a quick answer. And sometimes people use Google and I don't trust Google, so at least telemedicine enables me to reach an actual doctor and explain what's happening and get a proper answer.
It could be argued that of all the ways that technology has improved our lives and the lives of human beings across the globe, none are as important as technological advances in medicine. From the invention of X-ray machines to advances in surgical practice, technology has made us healthier and increased, of course, our life expectancies. As we move further into the 21st century, we continue to develop technologies that cure illnesses and improve our quality of life. Here to talk more about telemedicine as well as technology within the healthcare, we're joined by Dr. Vuyani Mhlome, the Chief Executive Officer and co-founder of Curo Medical. Good morning, Doc. How are you today?
Good morning, Musa, and good morning to your audience. I'm doing very well, thank you. How are you?
Aye, nothing to complain about on my end. Telemedicine. It's a term that is starting to become more popular, made very popular by COVID and things such as that. We'll get into that a little bit later on. But for the layman, for the guy on the street, when they hear this term, what should they understand from it?
So telemedicine is basically the delivery of remote solutions. So remote healthcare services. So number one is healthcare services delivered over a distance using information, communication, technology as a means of exchange. And therefore it becomes all encompassing, right? It could be telephonic, it could be SMS based, it could be video consultation, but most importantly, it is also, it could be provider to provider engagement, which means doctor to doctor, nurse to nurse, and other healthcare professionals. It could be doctor to patient, nurse to patient and other healthcare professionals. And then lastly, it could be happening live in real time as this conversation is happening, or it could also be pre-recorded. And then, the healthcare professional on the other end is then able to engage with the contents of that particular exchange. So that would be what I guess the World Health Organization definition is. And I hope it's simple enough for our viewers to understand.
So how did we get to where we are now with regards to medicine? I mean, the traditional practice of medicine is you walking into your doctor's room because your ankle is sore, and the doctor sees you after waiting in the waiting room for a little while, and you leave the office with medication in your pocket, and that's the end of that. So how did we get to this point?
I mean, if there's any industry, Musa, that has really evolved, it's healthcare, right? And we're seeing this, repeatedly. I mean, beyond healthcare, you're seeing the evolution and of certain industries, again, leveraging or using technology. For example, there's a lot of apps in banking. There is, people don't go into banks anymore to kind of queue up. You need to use an app-based system. The same is true, and I think we're seeing a very similar phenomenon within healthcare, right? Where how do you make healthcare a lot more efficient, a lot more accessible? Do I still need to get into a car or a taxi or bus and travel long distances to access my doctor. But also, what am I accessing when I want to speak to a healthcare professional? Is it their insight? Is it the physical presence? Is it the information they're able to give me? And so how do we then start segmenting the different aspects of the sort of healthcare engagement process to make sure that those that need to be in the doctor's rooms and the nurses' rooms and in the hospital are there, and those that can be treated at home or in other facilities can do so. And technology has, definitely assisted us in doing that. But I think what has significantly accelerated, the adoption of the solution, because it's been around, since the late 1990s in South Africa, but there's been a slow adoption within the public healthcare space as well as the private healthcare space. And so with COVID-19 coming in, where contact or human, contact would result in exposure to both the provider as well as the patient, we then needed to look at innovative solutions that enable us to deliver the same quality of care in terms of engagement, but that doesn't necessarily pose risks to both the patient as well as to the provider.
So what are some of the aims that you as a company, for instance, would try to reach in order to make sure that anyone that consults with you guys, or, the peer-to-peer sort of discussions that happen between specialists and things such as that, what are the aims of that?
I mean, our vision is to leverage technology, right, and to deliver premium healthcare solutions, right, that are more affordable and more accessible. The reality is that, given the current structure, right, we have what we call a hospice-centric model, a hospital-based type model of care, which basically says that you don't get access to healthcare unless you walk into the four walls or enter into the four walls of a doctor consultation room or enter into a hospital bed. The reality is that, right, healthcare can be delivered in different settings. In fact, more and more research shows that the home environment is the best place to provide care for both patients, but also the best way to deliver care by the doctor, because it results in better outcomes. There are certain infections that you usually catch by being in that sort of hospital environment. And so if you don't have to be there, you shouldn't be there. And so our value proposition to our people and our doctors and our nurses is we need to start embracing, innovative models of care that achieve one thing, and that is provide good quality care. So don't compromise on the quality of care of the patient, but still being able to drive down costs and improve clinical outcomes. And what we're seeing is that through our offering, we are able to avoid unnecessary hospital admissions. Patients are recovering faster. They're in a convenient environment, which is a home and surrounded by loved ones. Heck, they get to eat their own food, which is absolutely fantastic. And all the costs associated with sort of traditional in-hospitalization can be driven down. And really, Musa, what this does, it then sort of ignites or introduces a new model of healthcare delivery within our healthcare system that then subsequently improves, the efficiencies within the broader healthcare landscape. This means that a doctor who would ordinarily only be able to see one patient at a time has the opportunity to look after more, right? One of the things that we saw during, COVID-19, when hospitals were full and, and doctors were inundated and, nurses were run off their feet, was that the only bed that was guaranteed was your own. Yeah. And because of our own ability to bring healthcare, so hospital level care, to the patient's home. It then meant that we were able to prevent the unnecessary loss of life by being able to bring in all those essential elements of in-hospital care, leverage our technology or use our technology to provide real-time monitoring using cutting-edge technology, which I'm very excited to be talking to you about, that transmits that information to a 24-hour command center that is operated by qualified clinical professionals, which means that at the earliest sign, in the same way as you would get in the ICU or high care unit of a hospital, so at the earliest sign of clinical deterioration, so if something's wrong, is an abnormality in your heart rate or your temperature or your blood pressure, we've got eyes on those patients, and we are then able to initiate, through our extensive network of emergency medical services provider, clinical intervention that goes in and provides assistance in a much faster way. And really the importance here, Musa, is that we are able to monitor patients minute by minute, right? Whether they're in the shower, our technology is waterproof, or they're lying on the bed, or they're in the kitchen, anywhere within the comfort of their own home, which is very different to sort of traditional settings, right? Where if you're not in the sight of the healthcare professional and something happens, you are missed. So in other words, we've found ways in which I dare say to make the at-home environment even safer than the traditional in-hospital environment.
All right, we'll get into some of those technologies in a bit, but we've got a call from Udesh in KZN. Udesh, good morning.
Hi, good morning. How are you?
Very well, thank you. Do you have a question for Dr. Vuyani?
Yes, I do. Okay, you speak of all the medical technology in healthcare being available, to many South Africans. But my question is, why is it not available in rural areas? I mean, in rural areas, people are passing away like it's flies, to be honest. And it's a very sad situation. So my question, as I said, why is this technology not being, given to rural areas? Because they are the areas that actually need this facility the most.
For sure. Thank you, Udesh. Dr. Vuyani will answer that question now. So technology and the benefits of the technology that you, for instance, would use and why it's not being used in rural areas. How do we tackle that?
So the advantage of being able to, so firstly, thank you so much for the question. I think it's one that is important. Our commitment to South Africans and Africans, more generally, right, is being able to bring healthcare to even the last mile of health. And in our company, we're working as fast as we can in order for us to realize this particular objective for all South Africans, right? And so for us, what we also need to recognize is that you can't offer, services and solutions like this in the absence of other infrastructure. For example, having a reliable telecommunications platform to be able to drive this is an important area of focus. And we're trying and we are partnering with anyone who can, make this dream, a lot more realizable. For example, if I may give you an example, Musa, we partnered with MTN, right? Precisely for this reason about how do we partner with an organization that has got massive reach and reliable, communication so that we can get to those patients in those last mile of health. And so to the callers asked us that question, we're doing everything we can. We are moving as fast as we can, and we are trying to partner with anyone and everyone whose vision is aligned to ours so that such services and solutions can access those patients in rural communities.
All right, so work is being done. Very quickly before we go to ad break and continue the discussion after that, let's chat about the technology that you do use. During the insert, we saw some of the things, but what are the main points that you'd use to monitor a patient, for instance, at home? For the person sitting at home now watching and thinking, yeah, but how are they going to know what my blood pressure is? How are they going to know, what my heart rate is? What do you guys do?
100%. So, we are in 2021. Right? And so the age of having multiple wires connected to the patient is ancient, right? We believe in engaging in activities and technologies that allow patients to move around. So for example, what you would have seen is a wearable technology, which is a chest biosensor. It sits on the patient's chest and it collects all the information that would ordinarily be collected in the traditional hospital setting. So your heart rate, your respiratory rate, your temperatures, we've got the ability to collect, things like oxygen saturations, right? And in a way that is automatic, is continuous, and is reliable. And we do so, as I mentioned, wirelessly. All that information is transmitted to what we call a relay device. And this is something that we provide to our patients. And then it sends information to a 24-hour command center where all our clinical professionals are. And what's important for us is that it should not disrupt the patient's day-to-day activities, right? And so leveraging this technology, a patient is able to move around because, again, mobility is such an important element of patient recovery, right? And so for our part is, in many ways, actually, our patients say once they connect to our wireless and Bluetooth-enabled technology, they will forget they're wearing it, right? And that's really the point for us, is that once we're in the home, the technology that we use should not be in any way intrusive. It shouldn't define those processes. And so that's the technology we would have seen, that one has the capabilities and functionalities to monitor, physiological parameters that are not that doctors are not that are ordinarily monitored in the hospital setting.
Yeah.
The second thing is that doctors are able to, engage through a video consultation. And I heard one of the people you interviewed earlier on being worried about being able to be seen by their doctor, and how technology is able, can enable this. And over the coming months, we are excited to be launching actually an additional functionality where simply, patients are going to be able to have, their hearts and their lungs listened to, again, remotely, and all this information being transmitted in real time, and the doctor being able to hear from anywhere in the world. And I think that's the fundamental principle here, right? Is that at the moment, we are always dependent on our ability to get to the doctor. Our vision is to get the doctor and the healthcare professional to the patient. And technology is our ability to achieve all of this.
Great. So we'll continue our discussion with you right after the ad break. And of course, we're talking about technology in healthcare. How do we take things such as telemedicine, take things such as new technologies that can be used without the wires, and get better and better at making sure that the health outcomes of patients are reached? Continue this discussion after the break. Welcome back to Vital Science. I'm Dr. Musa Mtombe, and we continue our discussion with Dr. Vuyani Mhlome, the Chief Executive Officer and co-founder of Curo Medical, about medical technology in healthcare. Now, before the ad break, Doc, we had a discussion around the different technologies that you provide, but maybe let's have a broader discussion around what the future of technology in medicine actually looks like. Take us through that.
So the future of, of technology in medicine is pretty exciting, right? Because you can apply technology in different parts of, what we call the healthcare value chain, right? So, for example, we now have ways and mechanisms in which doctors themselves, can consult, as I've mentioned, with patients, in their rooms. There are digital scripts. I heard someone being concerned about being able to get a prescription in hand, and hopefully as our regulation kind of moves forward and improves to accommodate these advances in technology, a doctor would be able to, following a consultation with a patient, write a script that gets shipped to the pharmacy easily so that it doesn't inconvenience the patient. In fact, that could even be looped into, and that's something else we've seen, into that patient not even leaving home and having that medication, delivered directly into their home. Moving from there to the in-hospital environment, we now have, for example, technology enables doctors who are operating, for example, in distant towns, being able to provide support to people who, let's say, work in remote areas, whether it's, contributing to the consultation process, right through to even being able to provide what we call robotic surgery. So you have one surgeon sitting in one area of the world, and they're conducting an operation that is, taking place in another part of the world. And again, technology is something that enables us to do that, right? Right through, and I want to bring it a bit closer, for example, to, your audience and our people, right? So, one of the things that frustrate a lot of a lot of our people is the notion that you have to wake up in the morning and go queue for hours on end monthly to go and collect your medication. But today we've got a sort of a robotic dispensers that allows us to label medication, dispense the medication, and even have that medication delivered to the patients, in their homes without them having to, come through to the in-hospital environment. Yeah. Right through being able to link all of those things in an integrated way, right? Where if you are seeing one doctor or a nurse in a particular, area, you can get consultation without having to go to a particular hospital easily in a single setting. And again, technology is something that enables us to be able to do that. But right through to being able to prevent, diseases and illness, right? Being able to closely monitor your well-being through physical activity, to being able to track what you eat, and you've seen solutions, out there that also help improve, healthcare outcomes of patients, right through to being able to, if I'm suffering from diabetes or high blood pressure, I can closely monitor, for example, my medication, right through to have blood tests that are being done that that can be used to determine and use in a way that allows medication to specifically target the area that is problematic, for example, within your body.
Yeah.
And all of those things is really a function of technology. And I think the last thing I wish to highlight, which I think we've all been able to experience, is in the context of COVID-19, right? Never in the history of this world have we seen so fast, technology development, and vaccine development. And all of this was enabled, for example, by the way in which, globally, people collaborated, right? When institutions used to work in silos, they were able to then sort of aggregate resources, aggregate funds, putting out research and outcomes, in a way, in a manner in which that allows us to, improve the well-being of people and try and combat COVID-19, right? We've been leveraging, technology to challenge the level of misinformation, that is out there through, social media platforms and television, and all of those things come as a function of I guess, what technology has been able to do so that we can improve healthcare outcomes.
So the big discussion is, of course, we live in a country where the majority of people would be seen by someone in a public type setting. So you'd need to go to a local clinic or you're seen at the public hospital. But technologies like this obviously exist in the first world. Is there a point in which the two will intersect, where we as a third world country find ourselves with this technology being accessible to the poor man, to the guy on the street, without having to pay so much money out of pocket? Is this affordable?
Musa, this is the whole reason why we exist. This is our mission, right? As an entity, right? We leverage technology. We harness the best of our people to improve the well-being of others, right? Affordability and premium quality care or good quality care should not be mutually exclusive, right? This is something we fundamentally believe. And so, as I've said, right, we've launched this within the private healthcare setting, right? And we are very excited about our new partners that allow us to broaden our reach. But we are looking forward to being able to work closely with government so that, people who come from townships such as mine, Ekailicha, are able to access that, so that my mom who's sitting, in D section, for example, in Kalisha, is able to access that technology. And we keep and will work tirelessly. And I do want to highlight something that is important here, Musa, which is this technology is not the preserve of the rich or those who live in first world countries. Curo Medical has made it possible for this technology to exist today. And we are now, as I mentioned earlier on, working with different partners in order for us to be able to, access this. For example, we've had an unprecedented partnership with MedScheme in being able to offer that solution to, their clients, government employees, right? Teachers. We work with PolMed, being able to access this to police service personnel. We've got Bonitas Medical Aid that is trying to reach as many South Africans as possible. And what this is helping us to do is to constantly improve the value offering for more and more patients, so that even when we then are able to roll this out at mass scale for the public sector patients, we are not hiccuping on some of the other opportunities. So again, we are moving at an exceptionally urgent pace, so that this accessible is not this technology and service is not just geographically accessible, but also financially accessible.
Good. That's always good to hear. And I think just as we wrap things up, we live in a world of conspiracies and anti-vaxxing and all these sorts of things. And the big concern here would be, does this device not harm me? Does this device, what if it switches off? What if I go for a swim and it falls off and the monitoring is no longer there? What if the device fails? How good are these devices, and can people trust that, this stuff works all the time and I will be looked after?
Can you trust this? Yes, yes, and yes. Our Chief Medical Officer, Jeffrey Modise, mentioned earlier on that we go through a very strict regulatory process. And so it has gone through approval in the US, it's gone through approval in Europe. It's also registered with the South African Health Products Regulatory Authority, which is the regulatory authority for devices in South Africa. The second thing is that, as I've mentioned, because we've got the device on the patient themselves, we are able to track that minute by minute. And so there's not a single point where we don't have sort of a visual in terms of a visual on the patient. So at the earlier sign of either, a problematic device or it's no longer monitoring, or if they fall into the swimming pool, it will continue working because it's waterproof, right? But to your point, what's always important for us is do no harm, right? Technology should exist in society to improve healthcare for our people, not to harm them. And as a doctor, the first thing, right, is to make sure that one, I do no harm, and secondly, I only do good in society. And these are the things that are careful considerations for us whenever we launch a product, that it's thoroughly tested, it's gone through the rigorous testing and processing. But lastly, we've been using this thing, we launched about a year ago, and the numbers in which we're able to look after are increasing, and we haven't had a single incident in which patients have been harmed. And we are going to continue driving the solution so that we increase the uptake, because fundamentally what's always important to us is that the clinical outcomes, the health outcomes for our patients are best. And the technology, again, as I've mentioned, enables us to do so.
Thank you so much for joining us this morning as we spoke about technology in healthcare. All the important bits that we need to look out for, making sure that we use whatever is in our hands or available to us to our advantage. That was Dr. Vuyani Mhlome, who is the CEO of Curo Medical, speaking about all things technology and what we can look forward to as a country with regards to monitoring and bettering our health outcomes. Going for a quick ad break. When we come back, we'll look at some of the COVID-19 numbers. Welcome back. This is Vital Signs. I'm Dr. Musam Tumbene, and it's time for us to take a look at some of the national COVID-19 statistics. Now, this, of course, covers the period ending on the 12th of October 2021. Total tests that were done over the past over the COVID period that we found ourselves in, looking at 80,016,455, with total positive cases at 2,912,938. Total recoveries seem to be hanging out at 2,797,443, with the total number of active cases currently sitting at 27,066. Total deaths that we've experienced so far, 88,429, with new cases highlighting 592. It's time to take a look at some of the infection numbers that were recorded in the big provinces as well as the metros over the past day as well. Let's see what those numbers look like. KwaZulu-Natal sitting at 128 cases, Western Cape with 102, Gauteng 99 cases, and the Eastern Cape getting 56 cases as of yesterday. Taking a look at other numbers that are recording in the remaining provinces, these numbers look at like 71 in the Free State, Northwest with 51 cases recorded, Mpumalanga with 27 cases, and the Northern Cape with 42, Limpopo only 16 cases noted over the past day. Now, vaccine registration is still open to everyone over the age of 18, and of course you're all urged to go out and register so that you can get those numbers of vaccinated people much higher, and of course so you could lower the severity of COVID should you get it, and of course decrease the chances of you getting hospitalized. Let us also continue to take precautionary measures and make sure that we regularly wash our hands with soap, water, and using sanitizers that contain at least 70% alcohol content, wearing a cloth mask, and making sure that we stick to the big one, that is practicing social distancing and ensuring that proper ventilation occurs indoors. Lastly, avoid mass gatherings, and if you believe that you may be infected, please stay at home, and if you're going to go seek medical help, go out and give your medical provider a phone call so that they are aware that you are currently experiencing ABCD. Of course, you could use the public hotline, and that is 0800 029 999. That's 0800 029 999, and alert them of your symptoms. And remember to protect yourself so that you can continue to protect others. Those are the stats for the day. We continue now our discussion, and of course, every single time we have the show, we have Dr. Marlon McKay on, and he gets to answer some of the questions that you may have. Dr. Marlon McKay, good morning.
Good morning, Musa. Thanks for having me again.
Good. So let's talk about new advances with regards to COVID. What are you hearing on the streets, Doc?
Some very exciting news. So at this point in time, yes, we have vaccines, but we've never had any specific medication that can actually treat this coronavirus. We have medication that treats symptoms, and allow you to feel better, but nothing that can actually prevent you or reduce your risk of getting severe illness or landing up in hospital. And so in the news over the last few weeks, we have seen some great data coming through, very robust data, showing that with using a new antiviral medication, a pill that you take twice a day for 5 days, provided it started early in your course of illness, can halve your risk, reduce your risk of hospitalization by up to 50%.
Sure.
So you can imagine this will have, as we anticipate in the fourth wave, can make a big difference in the amount of people who may land up getting very ill and even land up in hospital.
With regards to drugs like this, antivirals and things such as that, we know that we've got the regulatory council that sits and has to approve medication. Do we have this medication in the country to ease those that have not been COVID positive before, or those that are worried that they may get reinfected as we get into a fourth wave?
Yeah, so we're at the point now where for instance, in the States, the drug company has applied for what we call EUA, emergency use approval, based on their current data and good results. So if that is passed and granted, then hopefully our regulatory body here in South Africa will do the same and grant them emergency use approval, which then will open or pave the way for the drug to be available at least hopefully by the time that the fourth wave hits us in expected time around December.
So the big discussion, especially with a drug like this, would be, of course, why so quickly? You know, it's an antiviral. Last year, you guys said we can't treat COVID. So why are you saying that there's a drug available now? And has it been tested enough on enough people for me to say that I can take it? What do we say to that?
Yeah, absolutely. So just remember, it's companies are developing new drugs all the time. And this is the same argument that we have with vaccines. It's not just because we have COVID that someone just woke up and said, let me just start working on a new drug. These drugs have been in development for a long time. They are now being tested against the SARS-CoV-2 virus. And these results are fairly positive. So they're not brand new in that sense. Number two, it has been tested. No drug will ever be passed, even for emergency use approval, without ever being tested. And so these are all in phase 3B trials right now. The results are great, and this is why they can apply. And the other thing is, as the tests are ongoing, the drug companies are so confident that they start manufacturing. So by the time, in the event that emergency use approval is granted, there is already stock. So rollout can happen fairly rapidly in order to make a difference in the new cases.
Okay, so let's get into some questions for people that are concerned about some of the things that they may have with regards to COVID-19. Lisa Hudson saying that anyone is diabetic and having high sugar readings since COVID-19. So question about COVID and having high sugars. Is this something we can expect?
Yes, absolutely. There was just a paper published in the week, and I did a talk on this last week. We're seeing a lot of new onset diabetes being triggered by COVID, whether it is the virus itself, whether it is the inflammation that usually patients who are at risk of diabetes because they're sometimes overweight can play a part, and also the stress of having such a severe illness on the inflammatory system. So those factors play a major role in new onset diabetes. So it can, for those existing patients with diabetes, it can push your levels out of control, especially if your doctor has prescribed corticosteroids or prednisone. And for those who are borderline, can definitely push you over the edge into established diabetes as a result of having COVID.
Okay, so we have a question now from SIFO in Soweto. Good morning, SIFO. Okay, SIFO seems to have fallen off the line there. But a question that I think is important is, you've spoken about diabetes, but a lot of people seem to be complaining about high blood pressure issues after they've gotten COVID. Is this something that's also been studied?
Yes, absolutely. So we see a lot of patients who present with headaches and on monitoring of blood pressure, and especially even heart rate. So they find that their blood pressures are elevated. So again, it's as if COVID, the illness itself or the virus itself, triggers something in you that makes your blood pressure go up. However, there are some patients who then revert to their pre-COVID blood pressure readings. They may need some treatment for a few months with strict monitoring of the blood pressure, but then we also see a significant amount of people who have then established high blood pressure who now have to stay on it for usually we say on a chronic basis. So it's very important to have that checkup once you've recovered from COVID, your sugar readings, blood pressure, possibly even an ECG, and just make sure cardiovascularly everything's intact.
SIFO seems to be back on the line. SIFO, good morning.
Good morning.
Yes, sir. Do you have a question for Dr. Marlon McKay?
Yes, yes. Yes, I have a problem with the asthma.
Okay.
Is it safe to take a COVID-19 vaccine?
All right, so COVID-19 vaccine and patients that have asthma, is it safe? Thank you, Sipho.
Absolutely safe. Just remember, the moment you have a chronic condition, a comorbid condition, you are more at risk of severe COVID, even though asthma is not really regarded as that serious. But to answer the question, Sipho, please, it is absolutely safe. You need the vaccine more than someone who does not have asthma, so please get the vaccine ASAP.
Mm-hmm. Are there groups that shouldn't take the vaccine? Who exclusively should not be waiting in line to get their jab?
So on a general level, I would say those who possibly have symptoms suggestive of COVID, in other words, you're ill, and that's more just to protect those who are in the queue. The other group is allergies. If you've had a severe anaphylaxis, a severe allergic reaction, either to like the first dose of Pfizer, it may be a problem with the second dose. In terms of allergies themselves, it is really someone who is allergic to a particular component that we find in the vaccines, polyethylene ethylene glycol, which is found in paint. And that's probably the only real contraindication. Absolutely not advisable to have a vaccine. So for the most part, for most 99.99% of South Africans, the vaccine is safe and we are all able to take it.
So let's touch a bit on that. I mean, a lot of people will say that they are allergic to something. Does that stop you from taking the vaccine because you have never had a severe allergic reaction? Or should those people go get the vaccine and, I don't know, wait it out and see if they do get a reaction?
Yeah. So two things there. Remember, if you are allergic, for instance, to penicillin, it means you cannot have penicillin, but you can have other antibiotics. If you're allergic to apples, it doesn't mean you can't have any fruit. So therefore, because you have some sort of allergy does not mean that you cannot have the vaccine. The second point is, if you have a history of allergies and you are a little bit fearful, take the vaccine. And this is why we allow, why it is compulsory to remain behind after having had the vaccine for at least 15 to 20 minutes at the vaccine site so that you can be monitored for any untoward reaction, possible allergic reactions. So it is safe. There's no reason to fear, and you will be well taken care of in the unlikely event that something may happen in terms of an allergy afterwards.
Dr. Marlon McKay, thank you so much for joining us today and updating us on what's currently happening in the world of antivirals and, of course, answering all those questions from people at home that want to know about all the conditions that they may have with regards to COVID. Of course, that is the end of the show. Thank you so much for joining us, and thank you to all the guests for making time to be on the show so that they can inform us on all the advances that are happening in technology as well as in healthcare. I'm Dr. Musamtomene. Take care of yourself. We'll see each other soon.